husband had died and I wanted to do something to make me feel better. I lost everything, my career, my house, my car. I was in the hospital all the time. I'm a prisoner of my house. I just feel very conscious, all the scars I have all the time.
Today, the Insider Exclusive goes behind the headlines in what no one tells you about weight loss surgery, to examine how Marc Pera, partner at the Pera law firm, successfully got justice for Marion Ferguson. Before you consider going under the knife, you need to know about the dangers of weight loss surgery. And this Insider Exclusive special edition will show you the real dangers. You've heard the amazing testimonials. Morbidly obese person has surgery, sheds 150 pounds, lives healthfully ever after. You've seen stars transform themselves. Carney Wilson, Al Roker, and if you believe the rumors, Star Jones Reynolds. It's no wonder the demand for weight loss operations have tripled since 2001 and that many women overlook the risk. But bariatric surgery is no quick fix. It requires major lifestyle changes and lifetime follow-up. It should be a last resort, say most experts. Here's some truths about weight loss surgery you won't read in celeb success stories. Surgery is only for the very obese. Although some unscrupulous doctors may operate on such people, the American Society for Bariatric Surgery guidelines say patients should have a body mass index above 40, which is about 100 pounds overweight. It won't necessarily make you thin. Bypass patients typically drop 50 to 75% of their excess pounds within a year of surgery. After that, weight loss levels off. And some patients, while no longer morbidly obese, are still overweight. What's more, some patients gain back 10 to 20% of the lost weight within 3 to 5 years. While weight loss surgery has helped thousands, doctors definitely agree cutting your stomach in half isn't an ideal solution, and complications are likely. Ever heard of MRSA? Think extreme staph infections. The Center for Disease Control warns that MRSA infections can result in anything from mild illness to death, particularly if the pathogen gets into the bloodstream by infecting a cut, burn, or laceration. MRSA, or methicillin-resistant Staphylococcus aureus, is a very contagious bacteria that can be quite deadly. In 2005, according to the Center for Disease Control and Prevention, 94,360 infections were caused by MRSA, and 20% of these were fatal. Hospital, nursing homes, and clinics are particularly susceptible and breeding grounds to spreading the infection. And MRSA is just one of the near-fatal complications Marion Ferguson unfortunately experienced due to the incompetence of her plastic surgeon. In this special Insider Exclusive TV edition, you will learn the frightening nature of MRSA, which is a rapidly growing problem in U.S. hospitals and communities. Furthermore, these increased dangers demonstrates the risk associated with plastic surgery. These factors should help prospective patients recognize life-threatening infections and the need for immediate cultures and treatment. Marion Ferguson's case is a medical negligence case, and Marc Pera clearly demonstrates how difficult medical malpractice cases can be and how far some defendants will go to try to escape responsibility. But because Marc has seen many innocent and hardworking people become victims of some incompetent, unethical, and unscrupulous doctors and hospital staff, he is driven to fight for these people who have been harmed by the willful or negligent actions of others. His goals, not only to get justice for his clients, but to make sure that similar incidents don't ever happen again with any doctor, at any hospital, in Cincinnati, in Ohio, or anywhere in the United States. Hi, I'm Steve Murphy, and this is the Insider Exclusive, live from Cincinnati, Ohio, at the Pera Law Firm. It is my great pleasure to introduce Marc Pera to the show. Welcome to the show, Marc.
Thank you. Good to be here.
Tell us a little bit about your firm. What kind of practice you primarily practice?
My firm is based in Cincinnati. We do work across the state, all the way up to the northern part of the state, all the way east over to West Virginia, and we cover the southern part of the state. What I primarily do is a good portion of medical malpractice, medical negligence type cases, do significant injury, personal injury cases, some cases that arise out of workplace injuries, and those types of things. But primarily we're an injury firm. We have an office in Columbus as well that does workers' compensation and Social Security work.
Today we have a very interesting case on weight loss surgery and how a doctor was basically incompetent. It's the case of Marion Ferguson. Would you tell us briefly what the facts are?
Yeah, Marion Ferguson was a woman, or is a woman at the time, that was obese. She was heavy. She wanted to do something to better herself. So she had a bariatric surgery done. At the time she had the surgery, she knew that she was going to stick with her diet. She knew that she was going to exercise. And when she was counseled by others who had gone through this type of surgery, she had been told, start saving your money because you're going to want to remove this excess skin after you lose the weight. So she did that. She saved her money. She stuck with the diet. She lost this weight. She became really an exercise fanatic, and went in to see a plastic surgeon.
5 years later.
5 years later.
Yeah.
It took 5 years to save the money. It took 5 years to get to the point where she was ready to go forward with some type of plastic surgery to remove that excess skin. And when she went in to see this plastic surgeon, she went in just for a tummy tuck, just to have that skin removed. When she left, she had been talked into doing a breast augmentation, doing liposuction, and doing what's called a full body lift, where they make incisions all the way around the body and essentially pull your skin up to try and give you a better shape, so to speak.
Now, as a result of all of these operations, what happened immediately after that?
Well, following the surgery, she had pain, which was to be expected. But a short time, about a week following the surgery, she developed a small red sore in her lower back area. And she went in to see the surgeon who had performed the surgery, and he noticed that she had this red spot. At the time, it was small. It was clearly infected. She had a high fever, and he just decided that it was just an infection, and he would give her run-of-the-mill antibiotics. He did not do what's called a wound culture, where they can go in, they can take a sample.
Find out what the problem is.
Exactly. If you don't know what the bug is, if you don't know what that infection is, then it's impossible to find. You may get lucky, but you're taking a gamble with that person's well-being. It went from one small sore to a second sore, and from that point, they turned into two huge gaping wounds to the point that you could have reached both of your hands through either wound and shaken them together. It led to infection in her breasts. She ended up having drainage, green drainage, foul-smelling odors coming from all of these wounds. Needed to have surgeries to try and correct the wounds, repeated wound care, very painful things. And it took more than a year for these wounds to finally heal up.
And she had a lot of trust in her doctor, but when she went home, and I think her therapist was trying to help her out, they eventually ended up, and we're going to have this other doctor here, Dr. Aletha Tippett.
Yes.
Going to another doctor, getting a second opinion. And this other doctor, Dr. Tippett, said, well, wait a minute, nobody did a wound culture? Which she did, and they discovered it was a MRSA, right?
Correct.
Staph infection.
Correct. What people refer to now as a super bug. It can only be treated. What that MRSA stands for is methicillin-resistant Staphylococcus aureus, which is a fancy way of saying that most antibiotics, most penicillins, are not going to work on this type of bug. So it's important to do that culture and figure out what will work.
Now, in pursuing the case, in prosecuting the case, what did you have to prove here?
In any medical negligence case, you have to prove that the doctor involved breached the standard of care. In other words, what you have to show is that that doctor did not do what an ordinary and prudent and reasonable doctor would do in the same type of circumstances. So in this case, what we had to prove was that a reasonable doctor, when seeing this post-operative infection, a reasonable doctor would have done a wound culture to figure out what the bug was so that that bug could be properly treated and quickly eradicated.
What were the challenges you had in representing Marion and trying to get the doctor to admit responsibility?
Any medical negligence case is difficult. I think the statistics both in Ohio and nationwide are that 80 to 90% of these cases are won by the doctors. So they're not easy cases to begin with. But to bring any case in Ohio, you have to have experts on board that have reviewed the case and found there to be negligence.
Today we're lucky enough to have with us the doctor that saved Marion's life, Dr. Aletha Tippett. And I'm going to bring her on right now. It is my great pleasure to introduce Dr. Aletha Tippett. Welcome to the show.
Thank you.
You are a holistic doctor. That's what you're known for, aren't you?
That's correct.
And when Marion first came to you, what was your immediate response when you looked at some of the wounds that she had?
Well, I do specialize in wound care, so I've seen thousands and thousands of wounds, but hers were more horrible than any I had ever seen of a healthy young person who had an elective surgery. I was just appalled by what I saw, and horrified. I was afraid she was going to die. I mean, she was really sick.
And your immediate response with anybody that has a wound like that is you take a culture, right?
Absolutely.
Send it out to the lab, find out what's going on, right?
Of course.
Were you surprised that the other doctor never did that?
When I found that out, I was very surprised.
Were you surprised that they recommended whirlpool therapy?
I was horrified.
Because basically that's enables it to spread, doesn't it?
That's correct, and a wound should never be whirlpooled. And I actually called the doctor and told him that, and he said, we do that routinely. And I said, you should rethink how you do that.
Yeah, now we're going to have Marion on in a little bit, but she said something to me before the show, and she said that you saved her life by a certain kind of therapy. What is that therapy?
Well, we used lots of different therapies. The one that I think really turned the corner for her was when we used maggots.
And tell our audience, you know, when you think maggots,
maggots.
How does that exactly work?
Well, maggots are fly larvae, a special fly, serracata, Lucilia serracata. You take the newborn fly larvae and put them in the wound. You just scoop them up with your...
Where do you buy this larva? Where do you get it?
Oh, I buy it from Monarch Labs. It's the only...
You buy it from a lab?
A lab. It's the only lab in the U.S. that sells the medical grade larva. And they're FDA approved, and
and you put the larva in there.
You just scoop them out and stick them in the wound, and then you put a covering over the wound. It takes them 48 hours to eat what they're going to eat. They eat dead and they eat infected tissue. And
they stop at the healthy tissue.
Oh yeah, they never eat
healthy tissue. And then what happens
to
the maggots? They fly away?
No, no, no. Their life cycle is they eat and then they want to go hide in a dry corner and turn into a fly. Right. So to keep them socially acceptable, we take them off after 2 days and we biohazard bag them and dispose of them. One
of the objectives of any of our shows is to try to steer people in doing the right things. And one of the things that struck me in this story was the fact that Marion went out and got a second opinion. And I want you to tell our audience how important that is.
That's very important. If for any reason you are uncomfortable or unhappy with the care that you're getting, whatever reason, you need to find someone else and ask them and have them weigh in too.
Yeah.
I mean, doctors are not infallible,
right?
Not by any stretch.
Well, thank you for saving Marion's life. You really did. And thank you very much for being on the program.
Thank you.
It is my great pleasure to introduce Marion Ferguson to the show. Welcome to the show, Marion.
Thank you.
Can you bring us back to the day after you had gotten the surgery, you know, that caused the infection, when you first started seeing that something, you had high temperature, what were your immediate thoughts?
When he kept me in the hospital another day, because I just was in so much pain, he told me that I would go back to work in 5 days, but I didn't even feel like I could walk.
Yeah.
It just scared me so much.
As this case went on, what have you learned about the medical profession?
They don't have your best interest at heart. Dr. Tippett was the exception.
Yeah.
I think she really did care.
When she originally brought up the fact that what might be successful is maggot therapy,
right?
What was your initial response?
I was horrified. I thought that was a terrible idea.
She explained they were going to put maggots in your body.
And I could feel them moving around in my back. That was very creepy.
Yeah.
But they saved my life.
They did.
When she took them out,
yeah.
I had to have them, I want to say it was 3 days.
Yeah.
And then they cut that plastic thing on my back and they all came out. Just the smell of the stuff that poured out of my back was sickening.
Yeah. And it must have been, life must have been very difficult for you then, you know, bathing and...
Just so much pain. I couldn't bathe.
Are you completely healed now?
I have big scabs on my back and big scars, but it's probably as healed as it'll ever be.
So what are you doing these days?
I watch my granddaughter and I'm going back to school.
Medical malpractice cases, as we've learned from Mark, and everywhere we go, are very difficult to win for a whole array of reasons. What is your opinion of Mark's firm and what he was able to do for you?
I think he was the only truthful lawyer in the courthouse that day, or that week.
Yeah. Sometimes you ask yourself, how do these other guys represent
You think
these
it's
people?
about the truth, but it's not.
What is it about?
I thought it was about drama.
Yeah, you know, the case was settled confidentially, but you are in a national forum right now. What advice do you give people out there who are going to have elective surgery, plastic surgery? What advice do you give to them so that they could possibly prevent some of the ordeal that you went through?
Just think long and hard about it. I would never, ever do it.
And check
it cost me everything.
Yeah, and check out the doctors you go to.
Well, I Googled him, but
yeah.
It only brought up his website. It didn't bring up anything else.
And that's another thing that you know very well, is that the AMA, the American Medical Association, and each state medical review board protects their doctors tremendously. You are never going to see any disciplinary action on a website. If you call a medical review board, you're not going to get anything. They're going to say it's confidential, aren't they?
That's right. It's a very secretive process. In fact, anytime something bad happens in a hospital in Ohio, it's typically investigated by the hospital. A peer review is done, and it's absolutely privileged in Ohio. You never get to find out the results of that.
And you don't get to see who the doctors that are most sued, do you?
No, you don't. I mean, you could try and do some type of search on a county website, but in terms of doctors that have been sued and paid money, the only people that have access to that information are the liability insurers.
Yeah, and that's totally wrong. That is totally wrong. Just like you can Google or find out information on a plumber or a businessman, you should be able to do the same thing for a doctor too, right? Because there's some bad doctors, aren't there?
There are.
You know? We like to avoid them. I want to thank you very much for being on the program. We have with us today, and we're going to bring her on right now, your sister-in-law, Bobby. So, because she was with you during this whole ordeal, so let's bring her on right now. It is my great pleasure to introduce Bobby Ferguson to the show. Welcome to the show, Bobby.
Thank you.
You lived with Marion during this whole ordeal, didn't you?
I did.
And it must have been something, right?
It was.
And also, when she was undergoing the maggot therapy, what were some of the problems when going out in the public?
She was very embarrassed. I'd have to walk. She'd ask me to walk behind her because she was afraid that the maggots were going to turn into the flies and that they were going to come out the top of her pants and that other people were going to see that. And she was very embarrassed with the maggot therapy, which I myself think saved her life.
Yeah, and the maggot therapy, it also kind of smells bad too, doesn't it?
It does. It's a horrific smell.
Yeah.
And the infection itself was horrific. I mean, you could smell it as soon as you sat in her car, or if you got close to Marion, you'd smell a bad smell.
I am totally amazed with the success of the maggot therapy. I'm just amazed, you know, and it really did save her life, didn't it?
It did save her life. It really did. I want to say an 80% turnaround after she got the maggot therapy.
Yeah. And
unbelievable.
And you had to help her almost on a daily basis, right?
I did. I'd have to put in the gauze and take it back out and help her with her wounds. It's pretty bad.
Well, thank God you were there for her, and thank you very much for being on the program. You know, Mark, in medical malpractice cases, there's a lot of people who say their doctor did them wrong. What do you look for before you take on a case?
Yeah, we get a lot of calls and talk to a lot of people that think they have cases. And what I explain to them anytime that we get a call is that we look at it basically as a two-hurdle process. The first hurdle, there has to be what we technically call a super goof. In other words, we need something that a doctor has done or failed to do that just seems awful to the regular person, to a lay person. And if we can establish that, and we get over that hurdle, the second hurdle is damages, the amount of money. Because again, we talked about the expense of pursuing these. Once you take away attorney fees and the costs of pursuing it, and then you pay back any medical bills that have been paid by insurance, there needs to be something left for the person bringing the case.
So it's going to be kind of catastrophic, doesn't it?
Absolutely does.
Well, I'm glad we had you on the program, because there are plenty of people that are harmed by doctors, whether it was accidental, whether they're just negligent, incompetent. They know where to go if they need a good attorney, and I'm glad you're on the program because you fight for the little guy. And I want to thank you for being here today.
Thank you very much. It was my pleasure.
You're welcome. Thanks for joining us. You can get more information about our guest and the issues at insiderexclusive.com.